Hello, my name is Morgan Henry. I am doing the assignment for class of MFT 6102 for Dr. Sutton. The class is called Psychopathology, Diagnostic, and Systemic Treatment Planning. And this week, week 4, we were told to pick a film to kind of work out a treatment plan, talk about diagnostic criteria, and talking about how we would incorporate family and treatment as well. So at first, I'm just going to give you a little bit of background. I chose the film A Beautiful Mind, which was in 2001. It was put up for several Academy Awards and won 4 of those. The director was Ron Howard. And going beyond that, I'm just going to kind of give a little brief overview of what the film's plot is, and then go from there. We're going to go into a diagnostic criteria for what I would say the diagnosis would be. And then from there, we're going to talk a little bit about, what the diagnosis, what kind of that looks like, what kind of background we're going to give for that, and then go from there into treatment plan and how to incorporate family treatment planning in that as well. Okay, so first we meet our main character, John Nash. In 1947, he has a scholarship to Princeton to study mathematics. We see at the very beginning that he has a roommate, Charles Herman, that studies in literature. From there, he goes on to be a professor and to study at MIT, doing research and things like that. But he kind of becomes bored a little bit with his work. And then around that time, he gets kind of involved with becoming part of the Pentagon's kind of code encrypting team. His boss is Will Parcher with the U.S. Department of Defense. Along this time, he also meets and marries Alicia Lard, and she's actually one of the students of his, and she kind of impresses him. They go on a date, and then they kind of go from there, kind of into this loving relationship. Going from back to the Pentagon, talking about encrypting codes, you see that he looks at different magazine articles, different newspapers, things like that, trying to see the secret messages that are given to him. He drops off codes at a house that he believes that's where he's supposed to do. And from there, he also keeps a relationship with his college roommate, Charles. And then we meet his niece, Maurice. And from there, we also see that John is kind of in this situation where Will Parcher kind of gets him in a little bit of dangerous situation where he actually witnesses a shooting between Parcher and a Soviet Union agent. And from there, he kind of blackmails John into keep doing his work because he has seen this and saying that, if you don't keep doing this, that, they're going to come after you, or I could hurt your family and things like that of that nature. And then kind of the pivotal point of the movie, I remember watching this movie when I was actually in high school for the first time, and this point in the movie, I kind of blew my mind because I didn't know what the movie was about. I never heard of it until, I was a sophomore in high school and we were watching it for a psychology class. And so this kind of is that pivotal turning point for him. You see him being a guest lecturer at Harvard. And you kind of see these suited figures coming up upon him. And John is kind of suspicious of them. He's a little bit afraid of them. And then you see him run out. And then all of a sudden you see him get a shot. And you first meet Dr. Rosen. From here, it's kind of that shock factor for a lot of people who weren't familiar with the film or what the film was about. And that you realize that people like his roommate Charles, his niece Maurice is not real, along with all of his code encrypting, working for the Pentagon, Will Parcher. All of those characters are not actually physically real to other people. You see John go through a treatment process of insulin shock therapy and antipsychotic medication. You kind of see John go into a zombie-like state for some of it. You see the shock therapy and things of that nature. And then you kind of see John relapse, and he goes and starts encrypting codes again. He starts seeing Charles again. It comes to the point in the movie where John is supposed to give his child a bath, and he leaves him with Charles because he believes Charles is watching him. And the child almost drowns, and the mother becomes very frightened. And she gets in contact with Dr. Rosen, not knowing what to do. And then she even gets herself in a situation where she kind of gets pushed out of the way and onto the floor while she's holding her baby. And because John believes that they are in danger from Parcher. And that's kind of the, point for Alicia where she's like, okay, I can't do this. You see her leaving, and it's kind of that moment where it's kind of incredible that John has this light bulb moment and says, Marcy doesn't age. I've known her for 3 years and she doesn't age. That's how I know she's not real. And then we kind of see this film progress and switch into this. He starts ignoring Parcher and Charles and Marcy, and kind of seeing this change. And he starts taking auditing classes, working on his theory for about 20 years. And then he starts teaching. And then you see him, there's an exchange where a student approaches Dr. Nash and says, starts talking to him. And then he pulls someone else aside and says, do you see this person as well? And they said yes. And it's kind of one of those things where in that moment, it's a little bit of humor, but at the same time, it's a realistic point for him. And they go from there. And then you see in 1994 that he wins the Nobel Prize for economics. And that's kind of where you see the film where he kind of leaves and he's won the award and he's in the lobby. And you still see Charles and Parcher and Marcy still there. And he kind of acknowledges them, but at the same time, he keeps going. From all of this, we're going to talk about the diagnostic criteria from the DSM-5 for schizophrenia. Some of the major things for schizophrenia that you need, that John does present is hallucinations. He does have disorganized speech. He has delusions. He also has disorganized behavior, and he also sometimes even presents negative symptoms. And criteria from Section B, the significant portion of time since the onset of the disturbance, there's been a persistent 6 months, including 1 month of the symptoms. Along with this, you kind of have to discount if he has schizoaffective disorder, depressive disorder, or bipolar disorder with psychosis. And all of these different symptoms, there's things that John does not present in the film. Particularly, we're going to start with schizoaffective. With schizoaffective and depressive disorder and bipolar with psychosis, and all of these, there has to be a overarching presentation of a mood disorder, and we don't really see that with John. You do see, some agitation, but that is due to some of the delusions and hallucinations that he is having and that is occurring for him. And so that can kind of be discounted for anything that would be directly a mood disorder for John. We're also moving on to criteria E. The disturbance is not attributed to psychological effects of substance or another medical condition. In the film, we don't necessarily have the medical testing that we could have, but there is no presentation of anything of that nature where we see in the film of that it could be, something like a medical disorder such as, a tumor or cancer or, where there's a hormone imbalance kind of situation, and there's none of that we see in the film. So we kind of have to trust that disturbance is not attributed to the psychological effects of a substance or things like that. So sorry. Oh gosh. Okay, we'll edit that out. Okay, Moving on to F, there's no history of autism spectrum disorder or communication disorder of a childhood onset. This, again, we don't know because it is a film and we don't really know the history or background of what is going on from John's childhood. But from the film, there's no hint of that. There's no, flashbacks or anything like that in the film where we can definitely say that this is what it is. And talking about current severities, in the film we kind of see throughout his life. So we're going to kind of focus on the main focus of the severity of how it is. And for this, particularly, we don't have to give a current severity, but we're going to go ahead and do that anyways. The severity scale, we don't have to specifically diagnose John with schizophrenia, but for this purpose of this exercise, we're going to go ahead and talk about how to kind of go with that. For delusions, that's pretty severe for him, and so I would definitely say that it would be a 3 or 4, along with hallucinations. That would be a 3 or a 4. Disorganized speech, sometimes this can be more severe for him, as we see him go into more towards his kind of the peak episodes for him, where he's working for the Department of Defense and working for Thatcher. And for this, I would say, at the beginning it's more of a 2, but I would definitely say towards the end it's more of a 3. Abnormal psychomotor, that's not as present in the beginning, but as we get towards, there is that development. So I would say that it would be a 0 to a 2. Negative symptoms for John, specifically for that, they are not present as much as the other symptoms, for such as just diminished emotional expression. That is there. He does have, not as emotional as a person, or, reacts to certain situations, but I would say that's one of the lesser factors of what's going on with him. So I would definitely say, a 1 on that kind of severity of a scale. Talking specifically about where he is, I would definitely say he has a multiple episode situation, but depends on where you are in the film and where you were talking about in the film, especially what you would say, because full remission, I'm not sure by the way that they present in the film. He still has the delusions and things like that, where he still sees the people there, and I'm not sure if you would count that as full remission, because he is living in society. He's doing meaningful work and things like that. So I'm not sure exactly if you would say partial remission or in full remission, depending on where you are in the movie and in the film. But I would definitely say it's a multiple episodes kind of occasion, because it's over courses of years that we see there is definitely more than one situation that is not realistic. And so that's kind of where we're going with that. Okay, moving away from the diagnosis and supporting evidence, we are going to go into the second kind of heading, the description of this disorder, and I'm going to talk about specifically 2 different articles that kind of talk about the differences of schizophrenia and how this can affect their social lifestyle, how they work, things of that nature, and how they relate to family, especially because, we're studying to be marriage and family therapists, and how this can affect people with schizophrenia and family members that have someone in their family that have schizophrenia. The first article is by Jennifer Matthews and Deanna Barch. It is from 2010. It's an article that has been published by the American Psychological Association, and it presents itself in the Journal of Abnormal Psychology. In the study, they kind of talk about a background from the emotional responsivity, social cognition, and functional outcome. That's the title of what it is, and that's kind of explains what it is as well. They talk about there are some deficiencies in social cognition that can affect working and family life. They start talking about in 1911, Bueller considers the flat affect of schizophrenia. And some studies have found that impairment can have a positive or negative aspect, but others say that, this kind of emotional response can still be intact in full in schizophrenic patients, but it can be minimalized whenever there are episodes that are occurring. Studies explain that emotional range and perspective are definitely inhibited, especially in working with film clips. There was definitely a specification with the study that, film clips seem to be a little bit harder for patients that have had, or clients that have had schizophrenia, that it was more difficult to look at a film clip and kind of decipher what kind of emotions were happening and going through that problem solving, kind of that process. And so they definitely specified that in the study, and so I'm specifying it here as well. They said that especially it's most significant during episodes, which I've already said. In their own study, they found that there is a decreased emotional response compared to their control. And so that can be definitely an impact for patients with schizophrenia or clients. With that, you want to talk about how this can be, can be frustrating, because sometimes when you have somebody that, you have things that are happening, people saying things are not real, things that you're imagining things, but also on top of that, having, that barrier of emotion and not understanding fully what's going on emotionally, and having that, being able to problem solve and understand what's going on can also be a really big inhibitor as well. So that's why I wanted to focus on that study and talk about a little bit about the emotional responsivity of it. The second study that I found was by Amy Wiesem Monti and Suro Julia. It is found in Psychotherapy in 2016, the Psychotherapy Journal, and it is published by the American Psychological Association. The article is called "The Effect of Culturally Informed Therapy on Self-Conscious Emotions and Burdens of Caregivers of Patients with Schizophrenia." I specifically wanted to kind of focus on that because we are going to talk about treatment plan here in a few minutes, talking about what, not just focusing on Dr. Nash, but also talking about his wife as well, Alicia, and talking about what it would look like for their family to kind of go in there. Because in the study, they discuss that 1% of the population has schizophrenia, but because of this disinstitutionalized movement of the past half decade, there's 50 to 90% of these people that are living with family members, a relative, a caregiver, a spouse. And so from that, there becomes this kind of caregiver burden, guilt and shame that's talked about it. And that's what this focus kind of the study is. But I really wanted to talk about it because, in marriage and family therapy, in this situation, there's more than one person that we're going to talk about with therapy. And that's why I wanted to kind of focus a little bit on doing that dual focus. In there, they found that over 20 trials suggest that there is a higher results and outcomes when family intervention is used or family therapy is used, including reduced risk to relapsing and reduced risk to symptom severity. So that's a pretty significant, kind of finding that family therapy and family interventions can be used to be helpful. They also said in the article that less than 7% of families that have someone that has schizophrenia receive family therapy. And with such great results, it's interesting findings that less than 7% are receiving this at this time. The study worked to incorporate spirituality and family culture to decrease this burden factor for the caregivers, but they also found that it was highly successful incorporating and trying to understand spirituality and the culture and ethnic backgrounds of the families, because, even the families that do receive family therapy, a lot of it is, focused on English speaking Caucasian families, the traditional family. And so there's not any exact curriculum for therapy or, specifications for specifically families that have someone with schizophrenia that has a different cultural background than that traditional aspect of what some people would call traditional, but may not be traditional on all cultural factors. Moving on from that, kind of talking about treatment plan. So sorry. My focus in MFT 5105 was narrative therapy, and so I feel that through this, I'm going to kind of explain why I chose this and why it's important. With narrative therapy, one of the big things that is focused upon, with narrative therapy, one of the main focuses for narrative therapy is this dominant discourse of what social and cultural norms expect of people. And so from there, there's a lot of how to hide and, try to from these dominant discourses in the midst of narrative therapy. There's, the 5 kind of phases of therapy. There's the first that's meeting, and the second is listening for the areas of dominant discourse and seeing how that's affecting the family's lives and how, it is affecting them and what kind of issues are going on, what kind of conflict this is causing for the family. And then going from there, separating the person from the problem, externalizing the problem and making way for experiences and new stories for them to form. And then phase 4 is enacting preferred narratives to see new and different ways of relating, producing more positive outcomes. And then phase number 5 is solidifying that. I kind of wanted to go through those steps before I kind of go into why I chose this. So that way, whenever I say phase 1, phase 2, phase 3, phase 4, phase 5, you can kind of know what I'm discussing. With all of this, the sense of agency is the preferred outcome. The point of preferred outcomes is to create positive self-empowerment, create hope with the clients that you are working with. And for this, I've specifically picked this for Dr. Nash and his family because I feel that with schizophrenia, there's a lot of dominant discourses of how people are supposed to be. And especially Dr. Nash, who is a professor, and how, you're supposed to be prestigious and nothing's supposed to be wrong. And you have to have, what I perceive, and not specifically knowing, because I can't talk to Dr. Nash or his wife, Alicia, in this kind of perspective of, what it is. So I'm kind of making some inferences of, that how he acts and how he isn't exactly fits in the dominant discourse box for how to be a professor or how to be, a professor's family. And so I think with Dr. Nash, he specifically doesn't like to be put into boxes. He likes to do things differently. He sees things differently. He is very intelligent. And with that, I feel like this kind of sense of, talking about sense of agency, creating your own story, talking about what these dominant discourses are for their family, can be really great, empowering for Dr. Nash and for his wife and for their son, especially due to not always feeling like they have the control over what is going on with the schizophrenia, talking about, the multiple episodes and things like that. With it, he likes to be able to control things. And in the film, you see that, he pushes away medication, and he does it basically by just saying, no, these people aren't real, doing a mind over matter kind of way. And so I feel like this would be a really good way of saying, These are our dominant discourses. This is what we've seen that people want us to do. And talking through those with Dr. Nash and his wife and their son, talking about how they want their narrative to be and how they want their story to create that sense of hope for them and to kind of empower them as a family to move forward into a better way of functioning together. Kind of dismissing that, these dominant discourses don't have to be who we are and don't have to define our family. And to kind of push those away. And saying all of this, with schizophrenia, and, any member, any person, or family that has someone that has schizophrenia in their family, sometimes it can seem like schizophrenia can be a death sentence, but at the same time, people can live normal lives for them. And normal doesn't have to be normal as what society defines as normal, because, the whole point of narrative therapy is pushing those dominant discourses and creating those sense of agency to create hope. And I feel like because of how Dr. Nash lived his life and how successful he became, getting the Nobel Prize for economics, that is a huge leaps and bounds for what anybody could have said that he could have done. And so that's why I really feel like this type of therapy would be really beneficial for that family as well. I thank you for listening. If you have, I hope you all have a good day, and thank you so much.